Good day, everyone. So it's time for us to discuss the basic infection control. So we're done with that days with the election and all, and then we are ready to face a new chapter of our lives, wherein we have to always keep in mind to move move forward and face every challenges that comes along our way. And of course, we have to remember that although sometimes we fail, yet it should be a time for us to pick ourselves back from falling down and then start anew. So we have to make sure that we were going to always move forward for our set goal, and that is to finish the course. So our module is divided into three. We have Basic Infection Control 1 and Basic Infection Control 2, as well as your 3. So I have decided to divide the three because I am going to name the first one as the isolation precaution, or the prevent from the very basic infection control, wherein you're going to prevent the spread of microorganism and even prevent the entrance of it to our body. So to discuss that more fully, so we're going to start. Anyways, we have your return demonstrations that will serve as your 50%, and the remaining 50% would be your final exam. Since we don't have any quiz, kaya nag-online lang man ta. And next time, in our basic infection control 2, we will do have a quiz. So, different na po ang atong setup. Okay, so, we're going to start your introduction. Why is it necessary for us to study the basic infection control? So as a caregiver or home care aide is directly involved in promoting health and providing a biological safe environment. So just like any other individual, we need to provide a safe environment not only to ourselves but also to the people around us. Therefore, one should be equipped with all the knowledge and necessary skills to prevent and control the spread of microorganisms that could cause disease in an individual. Infection control procedures are divided into two. We have your medical and your surgical asepsis. So, why is it necessary to prevent the spread of diseases? Of course, because there are lots of ways wherein the disease or certain microorganisms will be transmitted from one person to another. And with the knowledge of their transmission and then spread, we could prevent the occurrence of having or getting sick, diba? Or infecting another individual. So we have two divisions of the procedures: infection control, the medical asepsis, and the surgical asepsis. When you say medical, it is always associated with the clean technique or your daily activities or your daily practice at home before you're going to eat, before and after eating, before and after toileting, and before and after doing things necessary for the day. You have to do hand washing. While your surgical asepsis, these are procedures necessary to ensure that the object is very much sterile before you're going to start a certain procedure that includes your invasive one. What do you mean by invasive one? Procedures that have this tendency to gain access to the inner part of the body, from the word invasive. So you have to define medical as clean and your surgical as your sterile. And then we have asepsis. We're going to remember the prefix and the suffixes that we have studied at home. The prefix we have or before is pre, diba? Added to the word sepsis. Here is the sepsis, or sepsis. So sepsis means infection. When you're going to add, the rule in our English is when you're going to add a word at the beginning of the word, it will change the meaning of the whole word, di ba? So, from the word sepsis, which means infection, adding now A to sepsis, making it now absence of infection. Because, as it implies, any word placed at the beginning of the word will make the word change its meaning. Remember? So, this medical and surgical asepsis is well defined when it comes to our hand washing, which we were going to discuss later on. Anyways, if you have any questions, I know you cannot ask because, of course, but you could comment if ever, or you have to PM me kung naamoy mga questions. Because, ma'am, di ba may ka-question kay, of course, everything is smooth flowing here in the video. Kaya, magaling na YouTube na lang na ako siya kay para dili na ta maputol-putol kay sometimes no good if I'm sleepy, I tend to repeat sending the whole video several times. So much better that we're going to have it on YouTube para smooth sailing na ang atong procedures. Okay, so next. So again, medical asepsis, I have already discussed this one. Medical asepsis is defined as practices designed to reduce the number of microorganisms in an area or an object to decrease the likelihood of their transfer. It is similar to clean technique. When you're going to do the clean technique, before and after eating, before and after mag-jabs, what do you mean mag-jabs? Mag-poo, and before and after doing any procedures necessary for the day, especially if you're going to hold your eyes, hold your mouth, place your finger inside your mouth, or even place your finger inside your nose, ears, and all, you have to do hand washing after. And of course, before, if you're going to place it on your mouth and nose. Okay, so naman, because remember that your hands in this medical asepsis, hands are considered as the most dirty part of the body. It is considered dirty. That is why you have to clean it. You have to clean it before you're going to place it inside the cavity of your body. But of course, in your medical asepsis, if your hands, it should be kept clean nga naman, kaya ang imong hands kay kwan siya kanang dapat siya i-clean before mag-enter sa any part of the body. Plus, from the word clean technique. Okay. While in surgical asepsis includes all the practices and techniques used to keep objects and areas free from microorganisms, and this is similar to or synonym to sterile technique. When you say sterile technique, it means absence of infection. You have to keep the area free or 99 to 100% free of your infection. Free of your infection. So from the word infection, we have to define this as the invasion of body tissues by microorganisms and where they will then multiply and flourish. What do you mean by flourish? Flourish means flourish. Flourish. Flourish means, bakit wrong spelling kaya to? Dapat R, di ba? Flourish. Kasi flower na siya, di ba? I'm going to check that. So, flourish. These microorganisms usually penetrate inside the human body and grow, resulting to an illness. The growth of microorganisms depend upon the resistance of each individual. So, from the word invasion of body tissues, meaning microbes tend to enter inside our body, inside the tissues, and inside the cavity, or even the cell in case of your mouth cancer. And then where they were going to multiply and spread, diba? Example of this, we have the very well-known and popular, we have the COVID-19. Once the microorganism enters the body of the individual through, what do you mean, direct contact mo na siya because it needs person to person, tapos droplet nuclei. What do you mean by droplet nuclei? Once nga mapisikan ka sa laway sa individual, was the virus, automatic the virus will going to enter inside either your mouth or your nose, or nga naman sa mouth or nose mo nang kamot ang physical, because you place your mouth and nose onto your mouth. No, your hands onto your mouth. That's why you were going to get now the infection. So, di ba, it multiplies rapidly. Di ba, ang pila tayong yung capacity, even 1 person is to 6 person, di ba? Or I guess 3 to 6 person. So, pila man, katong 6 person, may infect po siya 6 person. So, it really cause what we call a pandemic, di ba? It will really cause a pandemic. Another thing, ano pandemic siya? Because remember, it is not a bacteria that could be contained, but it is a virus and it affects your respiratory system. Dali ra kay siya makaspread. We're going to discuss that one more fully. So, these microorganisms usually penetrate inside the human body and grow, resulting to an illness, and the growth of microorganisms depend upon the resistance of each individual. Okay, of each individual. Pag high ang resistance, that is why many people died because of COVID-19, may labot drama, because mostly they have lowered immune system or lowered resistance. Who are they? Mostly they are old individuals or elderly individuals, and who have also an existing condition or existing disease. Okay, existing disease. So, adding up na to the injury na ang COVID, di ba? But not necessarily nga mao due to say cause of the disease, naka-trigger lang ang what we call as your COVID microorganism or COVID coronavirus, di ba? Coronavirus. Okay. So here are microorganisms. These are organisms that can only be seen through the microscope. Kaya sinasabing micro. Kasi microscopic siya. Hindi natin nakikita. All microscope counts small living plants and animals that exist everywhere in the environment. It could either be in soil, so just like here the figure, and then on the body surface, just as the skin, intestinal tract, and other areas open to the outside. So, open to the outside, such as your mouth, upper respiratory tract, vagina, and that is your lower urinary tract. Not lower, ha? Lower urinary tract. I tried to edit na this one, but I guess my husband used the old copy. So we have areas has opening to the outside. So, di ba, your mouth, upper respiratory tract, where is that? There's your nose, down to your trachea. There's your upper respiratory, and then to your bronchi. There's your upper respiratory tract. And of course, your vaginal area, it is opening to the outside. Another thing is your lower urinary tract, that is your urinary meatus, di ba? Kanang magawasan sa ihi, to the urethra, that's your lower urinary tract, and then even it reaches your bladder, that is your cystitis, cystistis, cystistis, so that is your cystitis. Anything that ends with itis, meaning inflammation. Itis means inflammation. So, example, ang sakit niya is bronchitis. So, inflammation of the bronchi. Asa man dapat si bronchi? Naa sa imong lungs, diba? Kanang tube sa imong lungs, that is your bronchi. Before siya nag-wings into the lungs. So, that's your bronchi. Another thing, we also have your tonsillitis, diba? From the root word tonsil, which is a part or area of the upper respiratory tract, and then it has itis after the word tonsil, making now the word inflammation of the tonsils. So that's your tonsillitis. Types of microorganism, we have pathogenic and non-pathogenic. When you say pathogenic, from the word patho, it is capable of causing a disease, or patho means disease-causing microorganism. While non-pathogenic, from the word non, so not capable of causing a disease per se. So non-pathogenic, they are microorganisms that are, sige ba din ha? Helpful and are used in the production of certain foods such as bread, cheese, yogurt, beer, and your wine. So they are said to be important in the fermentation of the food, diba? Especially your beer and then your wine, cheese also. So they are called helpful microorganism. Example of those, we have your yeast, diba? Pampatubo. Pampatubo sa pat para madaghan, madato ka. Yeast are made of microorganism. Another letter B, microorganisms that belong to the normal flora group. What do you mean by normal flora? Normal flora means, sa siya? Ang normal flora is microorganisms that are normally found in certain areas of the body. So, certain areas of the body, example, sa imong mouth. You have a normal, inside the mouth, you have a normal flora microorganism. What is the purpose of that? Anyways, what is the name of that? One, I'm going to give you the Streptococcus. Streptococcus microorganism, and you also have Staphylococcus. Your Streptococcus and Staphylococcus are very important in the chewing of your food. It is going to produce normal kanang ginatawag na tong enzyme that is very much important in the breaking down of your food into pieces. Plus, it also helps the area to be well lubricated with your saliva. That is why it is present in the mouth. Mao na siya that if you're going to, they are healthy if it is in the mouth, because some of them, it will going to contain the debris of the food intake, causing it to stuck in your teeth, just like your immunoglobulin M or IgM. And then if it is now stuck on the teeth, so it will now become an infectious, diba? With the help of your normal flora microorganism. But your streptococci is normal flora and beneficial only if it is found in your oral cavity or your mouth. But once it will be given a chance to invade another part of the body, such as your tonsil. You remember, streptococci now is the causative agent of your tonsillitis. Again, if it is present in the oral cavity, good siya. But if it invades another part of the body, it will now cause a disease. If you are going to give it an opportunity. When is the time that you're going to give the streptococci opportunity? Example, just like what I'm doing now, I'm always talking in front of you. In front of you, Diloy, in front sa computer. So, in front sa laptop. So, I'm always talking in front of the laptop. So definitely, I'm producing more streptococci. Ganun naman. I need lots of saliva for me to talk well, di ba? And if it's so streptococci is also producing that much. And syempre, if I'm talking, I keep on swallowing food. I keep on swallowing my saliva. So there's a tendency that the streptococci will going to go with the flow with the saliva. And remember that I am straining my voice and I am straining my tongue still. So the microorganism now are going to be attracted to your tonsil, which is your first protection of your respiratory system, the tonsil, and cause now your inflammation, because your streptococci is now there transferred to your tonsil. It invades the tonsil. So remember, it is a normal, but it's found in a certain areas of the body where it gives benefit. But if it transferred to another part of the body, invade another part of the body, it will become opportunistic And if it is now opportunistic, it will grab the opportunity to cause a disease such as your tonsillitis. Diba? Another is staphylococcus. Asa sa staphylococcus? Sa may cause ng heart attack, baby, kagibtad niya po nag-heart attack. Why? Because na-inflame ang imong gums, and then of course, it was being inflamed, and of course there will increased production of your staphylococcus for the purpose of your guarding the area. But you suddenly extract your teeth with your pus and all. Now, pag pus and all, imong extract na imong teeth, then you injure now a blood vessel. What do you mean by blood vessel? Ugat. And then, of course, if you injure a blood vessel, the staphylococcus now has this gain entrance inside the blood vessel. And of course, it will go the blood in your blood vessel together with your staphylococcus. We're going to go to the heart, then to the lungs for oxygenation, or they're going to ask oxygen. And then yet, once they enter the heart, it loves to stay there and cause now your cardiac disease. Cardiac disease na dayon siya. So, maanang, bawal siya. Kayo, di ba? Gibtan naggipon, namatay, nag-cardiac arrest. That is one explanation why namatay ang taong giibtan og ngipon. Kay nga, no? Open ang blood vessel, hinsulod si staphylococcus, ato siya sa imong heart, then he loves there and then cause inflammation. So, the person now develop what we call this cardiac arrest, and that's all. And of course, the person died. Okay. Manang dapat bantayanan. Just as an example also, your normal flora microorganism, the E. coli. E. coli or your Escherichia coli bacteria. Where is E. coli found? Your E. coli is normally found in your large intestine. Where is your large intestine? In your gastrointestinal tract. Asa man ang gastrointestinal tract nagsugod? Gikan sa baba, padulong sa lubot, or from mouth to anus. Okay. And your large intestine, it is where that the complete digestion of food takes place, because it is now the storage of your product of digestion. What are the product of digestion? We have now your feces or EH. So, daan na siya dito si E. coli. Dito sa large intestine. Para sa siya sa large intestine, it helps the feces to be well lubricated for easy elimination. Diba? It also gives the feces a distinct smell to prevent it from a very offensive odor. That is your E. coli. But, since E. coli is very much present in your large intestine, and the end point of your large intestine is your anus. So, basically, E. coli is found in your anal area. And if it's found in the anal area, so definitely, your anal area is pretty much near with your urinary meatus, or your vaginal area where urinary meatus is located. And then, of course, if you're going to have a bad practices such as decreased water intake, highly salty food intake, and then, of course, problems with your personal hygiene. Either you keep on washing your vaginal area, destroying the normal flora bacteria there, or you prevent washing the genital area, making now the normal flora microorganism to multiply very quickly, diba? So definitely those are the causes, and then of course your E. coli now will become the causative agent of the cause of your urinary tract infection. Okay, urinary tract infection. So the cause of UTI is E. coli. And then si E. coli asa siya maayo dito sa enlarged intestine. But you gave him the opportunity to gain entrance into your urinary meatus, causing now your infection. Okay, question? Wala po question because you cannot answer. Anyways, you could PM me if ever nga na may mga question. Another function also of your E. coli, it also helps to manufacture vitamin K. As the vitamin K manufactured dito sa large intestine, what is the responsibility of vitamin K? For blood clotting. Okay. So, class, we have the types and now kinds of microorganisms. We have your aerobic. From the word aero means air, and anaerobic microorganism. Aerobic means microorganisms that needs air in order to multiply, while your anaerobic are microorganisms that doesn't need air to exist. Okay, the following are necessary for the growth of microorganism. One is the host, and that is us. Second is your warmth, and warmth meaning init or warm-blooded. Darkness means ngit-ngit, oxygen for aerobic microbes, and microorganisms multiply very quickly to your highly moisturized area. Unsa man na siya highly moisturized area, katong mga tingot gamay, di ba? So, di paningot. And then, of course, your food. If you have these six, then you will have the growth of microorganism. Okay, you will have now the growth of microorganism. Asa man na silang area ba? Example, moisture. Naasa yung oral cavity. Mo nang dapat mag-brush kag teeth 3 times a day. Para ang imong food residue, dili siya mo, ano man siya? Ang mga microorganism dili mo penetrate sa imong ngipon and cause now your damage. And if it is damaged, of course, one thing you have to remember, if there is present a microorganism, it produces, the area will produce now a foul-smelling breath. Diba? Just like sa armpit. Okay. Ganang baho mag-ilok because you are highly sweating. And of course, kung from the word moisture plus darkness there, it is now conducive for the growth of microorganism. Okay, for the growth of microorganism. So that is your necessary things for the growth of microorganism. Now, we will have the normal body defenses before we're going to go further on the discussion. So, normal body defenses meaning you have, although the infection per se na siya, it is already present, but still found na si infection, but still you have what we call as defense. So we call defense which are normal, excuse. So the statement there is what else besides a living plant or animal is able to repair itself? No one or nothing. And among living things, what exactly the human body is carrying business as usual in spite of unfavorable condition. So remember, if ever you are sick, you are not feeling well, but because of your commitment with your work, you still do go to work, diba? So business as usual. A good self-winding watch is one of the most reliable mechanisms in common use. But sooner or later, something will go wrong with even the best watch. So tanan nga relo, maskin pag mahalon or baratuhan, maguba agad siya. Oh, maguba agad siya. Just like this one, mahalon siya. Ba't maguba Japon eh? Okay. And then, it will never, where am I? So, but sooner or later something will go wrong and with even the best watch, and it will have to be repaired. No one expects an ailing watch to repair itself. Well, it's only human being that repairs itself. What automobile maker dares advertise that his car will repair itself? What car can smooth its own crumpled fender? So no one, diba? What car can mend its own torn upholstery or repair a spot where the animal has been knocked off? So wala. Dapat you have to ask somebody to repair the car. What car can break a brake if it's ano, in its own frame. Yet we take it for granted, di ba nga naman, that the human body can make its own repairs. It's only the human body that can make its own repair. Diba? So we have, but in many instances, it is able to fend this off in advance. Bisan pa ang wala patan natakdan og microorganism, we even protect ourselves in advance, diba? Individuals normally have defenses that protect the body from infection. These defenses can be categorized as your non-specific and specific defense. So let's look at it kung asa non-specific. Non-specific defense protects the body from infection or microbes regardless or prior to infection. It includes, from the word non-specific, it includes your anatomic and physiological barrier, diba? And so we have your anatomic and physiological barriers under your non-specific defenses. So remember that the non-specific defenses are there either from they're already present prior to exposure. So one is your intactness of the skin and mucous membrane. Remember that your skin is your first line of defense. That is why you have to protect it from any crack or broken. You have to protect it from any crack or broken. What do you mean by any crack or broken? Dapat yung skin wala po siyang wound. That is why any person who has wounds are not allowed to handle yeast that is very much present in the bakery. That is used yeast. Remember that yeast is normally it is a non-pathogenic microorganism. But once you're going to give them a reason to invade another part of the system or another part of the body, they will become opportunistic. So, for example, yeast is very much helpful in the preparation of your beard, bread. It's just like what I have mentioned a while ago. But it is very much disease causing when you're going to give them the opportunity to cause one. So, saan man siya pagka-cause of disease? So you have to expose the person, yeast to the person with a certain break in the continuity of the skin or naa-shy sa mud. Then they should be protected from any crack or broken. That is why you have to keep them intact. And dryness of the skin is determined to microorganism. Remember, microorganisms are present in moist areas. That is why you have to keep your skin always dry. Okay, but there's also a but. If you already reach the elderly stage wherein you have that is your 65 years old and above, and not necessarily 65, but especially in women, if you reach 50 years old, you need to moisturize your skin also. Why? Because the problem now with your skin is the moisture is very much a conducive place for the microorganism combined with your darkness. But if you reach older age, if your skin is also dry, 50 above, diba? Just like, for example, in women, you have already reached the menopausal stage or overcome the menopausal stage. So meaning, if you're going to because of menopausal stage, there will be inability of your system to produce, but particularly the reproductive system, to produce oils, diba, hormones that we're going to make the thinner of your buna, and then the suppleness of the skin, and the smoothness of the skin. Another thing, the skin now has this inability to retain fluid, causing it to become more drier. That is why application of your soap to the skin of an elderly, we're going to cause more drier. And if the skin is dry, the elderly, we're going to manifest itchiness. Katul siya, katul, just like this one. Itchiness. And if that's so, the elderly is prone to what we call the injury, diba? So that thinking samad-samad or garas-garas ang tigula because of the problem of dryness. But basically, at normal scenario, when the person doesn't reach does not reach the elderly stage yet, so you may now make the skin always dry. Okay, so dry, and then another is the presence of sebum and fatty acids also protects the skin from the invasion of microorganisms. So, kanada imong skin nga highly tag in intact with tambukon ka, with tambok, and especially if you're sweating. If you're sweating out, you are now trying to help the skin in removing the microorganism that try to enter inside. Next is the nasal passages. So the nasal passage is it has what they call as the cilia, which is the hairy-like projection that traps microbes, dust, and foreign material. So cilia, that is the action of the hair present inside the nose. Present inside the nose. Because remember, at the beginning of the day, have you observed when you go to clean your nose or make some kalungat, and then after that, you're going to go to work and then expose yourself to the street, example, the dust, and then the jeepney. So, ini, kanabitang tambok yung sa mga jeep. Then, causing now, at the end of the day, your nose will become, your dry mucus, or sa Bisaya is mo, will become black. Nga naman, your cilia function to trap the microbes away, to trap the microorganism and contain it for you to easily remove it in a form of pugmo. Okay. And then next is the lungs. The lungs have alveolar macrophages, or the large, which functions as large phagocytes, or has this phagocytotic action. What do you mean phagocytotic action? They are WBC, or white blood cells, that ingest the microorganism that try to gain entrance into the cell. So, kapag mo sa Pacman niya, for example, this is the microorganism inside your lungs. Kanang mga grapes sa imong lungs, okay, so inside your lungs, na siya grape, or lingin, crumple na mga lingin. Mga tawag na is isa na is alveoli. So, alveoli, where is the place where the gas exchange takes place? So, inside your alveoli, it is protected by your phagocytes, phagocytes, which is your WBC, active WBC, or your police cell, which it try to ingest the microorganism that gain entrance. For example, this is now your phagocyte, this is now your microbes. The phagocytes are going to engulf it and then be able to contain it. Kanon niya, or iyan na siyang i-coat niya, causing now the microorganism to be non-infectious. Diba? Kina-coat mo niya. And then we have, remember, WBC, or the white blood cells, are your police cells, and inside the body it should be 5,000 to 10,000 international units as a number. If it is below 5,000 to 10,000, or let's say below 5,000, meaning your WBC or your body was being conquered now by the microorganism. But if it is above 10,000 as a unit, your WBC or your police cells or soldiers in the body are still active and trying to fight back the invasion of a certain microorganism. So, asa may mas dangerous ato kung baba na kayong in WBC or less than 5,000. But kung 10,000 or 10,000 above, you would notice that you will manifest fever. So, you have increased body temperature, meaning your system is very much well and good because they're still fighting against the microorganism. In common diseases such as this, we have your increasing WBC mo, you are going to suspect in females that is your urinary tract infection. But kung baba naman si WBC mo, you are going to suspect typhoid fever, which is more infectious compared to your urinary tract infection that is caused by E. coli. So do you have any question? We're going to proceed with the CNS. The CNS, or the central nervous system, is protected by the skull and the spinal cord. Hindi siya basta-basta penetrate ang yung brain. So, the brain or the central nervous system. Bakit? Ang head kaya ng skull natin, o yung meron pa siyang pathway na ang tawag is spinal cord before it will going to enter inside your brain. Another thing, in the spinal cord, there are also mga protective microbes, diba? That we're going to serve as soldiers, such as your WBC, that we're going to fight against the microorganisms. So your brain is definitely hard to reach or hard to invade, unless if you allow it to be invaded. For example, there's crack or broken in your skull, so it will going to cause now your problem. Just for example, a vehicular accident, tapos it hits the head. What happened if your head is being hit by as an object and it is now cracked? So now the microorganism will try to gain entrance. So it will lead now to more infection, and it's hard to cure. Okay, hard to cure, and it needs lots of things to do before you could be cured with that. And mostly, not all ang cure, mostly it will going to result death, unless if you have plenty of money, because you could send somebody to more expensive and highly technical, highly advanced hospitals. Okay, next is oral cavity. Your oral cavity is protected by your saliva, which contains microbial inhibitor. But from the word inhibitor, it will going to inhibit the growth of microorganisms. Anong pangalan ng microbial inhibitor sa oral cavity mo? That is your lactoferrin, lysozyme, and your immunoglobulin A or your IgA. So it has now your microbial inhibitor that will prevent the oral cavity to be invaded by the microorganism. Your lactoferrin is an iron-binding protein that inhibits the growth of microbes, while your lysozyme is an antibacterial agent. From the word antibacterial, it is going to kill the bacteria, diba? Your lysozyme, an enzyme that kills the bacteria. Another thing, you have your immunoglobulin A as part of your immune system. IgA, it coats the bacteria that prevent the attachment to the oral epithelium and to the teeth. So what happened? Yung microorganism that gain entrance into your oral cavity, iko-coat po yan ni IgA, thus becoming less infectious, and of course, it cannot be attached now to the epithelial cells or your teeth. Letter F, your eyes. Remember, your eyes is protected by tears that continually wash the microbes away. So, it is to say, if you cried out loud, di ba? Pag umiyak ka po, out of nothing, you just tell the people around you na, no, why are you crying? You will just say, I'm just washing my eyes from microorganism. Di ba? Social ang dating. Next is your letter G, your gastrointestinal tract or your GIT. Your GIT or your gastrointestinal tract starts from the mouth down to your anus. Your GIT, it is protected by your acids, diba? What are your acids? We have your hydrochloric acid. So your hydrochloric acid is very much from the word acid. It could even melt a rock, huh? Your hydrochloric acid could even melt a rock. So how much more kung microbes lang? And your normal flora microorganism. So we have there your normal flora microorganism. We have your E. coli or your resident bacteria or resident microorganism. What are they? Normal flora or resident microorganism? Those are microorganisms that are normally found to certain areas of the body and which they are considered beneficial. Vagina. Well, your vagina is protected from growth of microorganism by maintaining its natural pH of 3.5 to 4.5. Diba? Remember in your lactacid advertisement? Ngayon, and then we have something na gani. Kalimot ko itong isa. Ngayon nga, 4.5, 3.5 too acidic. 4.5, okay. So, diba? So, you remember, not too acidic man, your vaginal wash should not be too acidic. Well, when it is too acidic, it will going to destroy the natural microorganism in the area. And once it is destroyed, it could cause itchiness. Next is your urethra or your urine. Remember that we're going to urinate. We're washing our urethra, and other your ureter and your bladder, urethra from the microorganism. So you are washing now your what we call this one urethra or your ureter at first because your urine is manufactured by your kidney and we're going to pass your ureter to your urinary bladder, and until then it will going to reach your urinary meatus via your urethra. So next topic is your inflammation. Inflammation is an adaptive mechanism that destroys or deletes the injurious agents, prevent further spread of injury, and promotes repair or of damaged tissue. So from the word inflammation, I'm going to give you an example. Diba you have pimple on your face? Diba? Pimple. If you have pimple, you would notice pag hindi mo siya ginalaw, basta-basta lang sila, ngayon na sila nahinog na yung bugas. Diba? Because you did not touch it or you did not cause irritation on it. So, during that time na nahinog na yung bugas, when you're going to prick it in your mouth, you would notice a certain yellow colored thing that would be meaning na nahinog na. So that is now your pimple, di ba? Or you just contain the pimple for a longer period of time, causing it not to be infectious and easily be removed. But if you're going to pick it, of course, it will going to cause more infection because your hands are dirty. Diba? Dapat, you have to allow that to ripen itself and be removed by itself also. Okay, so pain is easy to overcome simply as merely misfortune or nuisance. The real purpose of pain is to alert the client, the ailing for a patient something that something is needing attention. So do you have any question with that? 5 signs. You have pain, swelling, redness, heat, and the impaired function of the part if severe. That is your 5 signs of inflammation. So those are the things. And you try to take note also the Greek word of that. We have pain or dolor, swelling or tumor, redness or rubor, and heat or calor. Okay. Components involved in inflammation, of course, diba? It needs blood vessel. Blood vessel is necessary for the transmission of nutrients to the particular cell being damaged, diba? So, yung blood vessel niyo po. And then, of course, the blood. The blood should be the healthiest possible. And defensive cells, that is your macrophages and microphages that are going to engulf the microorganism that gain entrance to your body. Then the antibodies and plus your surrounding connective tissue. Okay. Types of, we have all the types. We have acute or chronic. We have the acute short duration, that is a week, sudden onset, and then maximize severity and symptoms are readily seen. While your chronic, that is your gradual onset, minimize and less injury to the tissue. Okay, less injury to the tissue. So that is your acute, diba? And your chronic. So for example, your appendicitis, is it chronic or acute? Of course, it is acute. Why? The person does not hospitalize yourself for how many years, diba? So it is acute. Karon lang. Why? Kasi sakit yan. But other than that, wala. And then chronic or prolonged from gradual onset, and then your minimize and loss injury to the tissue. That is your chronic. Okay. Question? No more? Okay, so for example, also your chronic, for example, is your tuberculosis, your cancer, which is you are diagnosed previously, but you're still alive and seeking for treatment. That is your chronic, meaning for a long period of time. Okay. Now, purpose of inflammation, excuse me, is your protection and repair. Why protection? Once there is inflammation, remember you have pimple here, most likely you don't want that pimple to be touched or you don't want it to be scratched. Why? Because you're trying to protect it from infection. Diba? That's your protection. Just like sa drawing is, we have there's inflammation on the arm of the individual, and then That is what happened there. This one is your police cells. Kanang mga butiki dira mabakukang. They are the police cells, they're trying to repair also your inflammation. So that is the two purpose of your inflammation or inflammatory response is your protection and your repair. Okay, next is we have the healing process. Healing process is the replacement of dead cells and necrotic tissue to healthy cells. So healing from nuka to wala na. From pimple to hamis balik. That's your healing process. So factors affecting the healing process. One is your age. What age? Children and healthy adults are heal more rapidly than elderly person. So let's go back to what we have learned in your elementary, your high school, the wear and tear theory, diba? So elderly person, they have already used up their immune system and their immune responses. So definitely they were going to heal poorly. Manang dapat hindi sila ma-injured. Another thing, especially fracture, Another, kung children din, syempre yung children is underdeveloped immune system, underdeveloped yung mga bones nila. That is why, if they become crossed with fracture or mabali ang bukog, they heal also poorly. Except for those adults or mga teenager who heal fast compared to them. Number 2 is your nutritional status. The highly nutritious foods that you are eating every day, definitely the faster the healing process is. Remember, what is the nutrient responsible for wound healing? That is your protein. By protein as partner, we have your vitamin C. Vitamin C. So protein plus vitamin C will lead to wound healing. Number 3 is extent of injury. The bigger, the deeper, the longer the injury, the longer the healing process. Example, ang scratch ra nimo or garas, i-compare nimo stab wounds or giluba. So definitely, hinay gyud ang healing process, the deeper and the bigger and even the longer the injury compared to a superficial scratch. Number 4 is tissues involved. The remote area, remote distributions of blood, poor healing process, especially if the remote area. So where is the distribution of blood takes place, particularly on your heart, diba? Daghan kaayong oxygen dira. Anila, because it is near your lungs. So dira ang area sa chest area, mas kung maka-scratch ka dira, mas paspas ang healing process niya compared sa scratch sa imong tiil. Because it is highly vascularized area or daghang blood vessel compared sa imong tiil nga ang oxygen maato sa imong tiil. Remember, the oxygenated blood coming from your heart with the oxygen, with its carried oxygen from your lungs. Pag ato niya dito, bringing now your nutrients, pagbalik ka na sa dugo, wala nang balik sa iyong heart para mga po siya nutrients, dugay na siya makabalik, especially if you're already old, because the blood vessels already atrophy. What do you mean by atrophy? Na kipot na siya, dinanarrow na ang size of blood vessel. So, syempre, the remote the area, the longer the healing process because of the remote distribution of blood. Number 5 is blood supply. So, same as your tissues involved, the remote area, poor blood supply, and poor healing process. Then, factors affecting healing, again, we have number 6, presence of infection. What do you mean by presence of infection? If you have another or secondary infection, you will also suffer from longer healing process. Just like, for example, na hospital ka because of a certain disease condition. Let's say, acute respiratory disease, or ARDS. So you were going to manifest cough and coughing, sneezing, and all. Coughing, sneezing, and all. And then yet, you're exposed to other diseases and microorganisms such as your pneumonia in your kanang roommate or patient who happens to stay in the ward, diba? So because of the presence of lots of microorganisms there with different disease condition, you are prone to develop another infection. Plus, of course, because of the present infection that you are having, pag makatakdan ka of a certain disease, you are going to heal poorly. Okay. Next is your presence of foreign body. So, dirt inhibits wound healing and may cause infection. Just like for example, masugsug ka, di ba? Pag masugsug ka o kanang let's say, tukog sa saging, di ba? Pag masugsug ka, tukog sa saging, so definitely, you heal poorly, di ba? It will affect the healing process. Or let's say, pag vehicular accident, if there's vehicular accident, and then, excuse me, it affects now there is a vehicular accident affecting now your head. Tapos na siya mga foreign objects such as your what we call this one, kanang mga glass or glass splinters. So, or let's say dirt. Basta dirt siya. Nasamat kasi mong face na nagkain dirt, there was na glass splinters. Usually, you have to wash that wound of yours in the face. Dapat i-wash siya with running water. Nganong kay kung dili naman na siya i-wash, if it so happens you fail to wash it, tapos there is presence of foreign bodies such as the dirt, the debris, the splinters, glass splinters, so there's a tendency that we're going to create infection, thus leading to poor healing process. Another is oxygenation. Oxygenation of tissues is decreased in a patient with anemia and individual who smoke. So remember, oxygenation is very much necessary for wound healing. Why? Because the nutrients that you're taking in, combined with your oxygen, will be carried by your blood together with other nutrients such as your protein and your vitamin C. And if it happens, it will now lead to wound healing. Okay. Then, for example, if you smoke, so definitely you have problems with oxygen or your gas exchanges. And if it occurs, remember, poor gas exchange, or like people who smoke or anemia, has problems with your healing process. And then number 9, so that is your smoking. Ano man, if you smoke, the blood vessel will become narrow. Ano siya? It will be occupied with your nicotine, the side of it. It will be occupied with nicotine, and sometimes it will going to thicken, or what we call the atherosclerosis. It will lead to atherosclerosis or problems in your blood vessel. Next is specific defects. We have, first is your immunity. Immunity is the ability of the body to protect itself from foreign body. So immunity, excuse me. Oh, diba? So, example, if your immune response is high, so definitely if you will be exposed to certain microorganisms, you won't be affected. Why? Excuse. Because you have that high immunity. How? So example, by taking lots of highly nutritious foods and getting adequate sleep, adequate rest, and of course feel free from stress. Another is adequate nutrition, and of course diet, exercise. It will going to boost up your immunity. And if it happens, you cannot be easily contacted by certain microorganisms such as your COVID. Types of immunity, we have your active immunity and your passive immunity. Active is either active natural or active artificial. So active means the host produces its own antibodies in response to natural, such as infection, or artificial or vaccination. For example, sore eyes. Diba? Or let's say chickenpox. Pag chickenpox ka, you have that immunity already from chickenpox. So meaning you cannot be infected again by chickenpox because you already have an active immunity. While your active artificial, the antigen itself protects you from certain microorganisms, such as what we are having, the immunization of COVID-19 vaccination, or those are the things, those are the exact, what we call the example of your active artificial antigen that will going to boost up your immunity against, specific disease or infection, the COVID-19 virus. Okay, then is your passive. Passive antibodies are produced by another source, such as animal or human. We have passive natural and passive artificial. So we have passive natural. We have your antibodies are transferred from an immune mother to her baby through the placenta or in colostrum. Colostrum is the yellow colored milk produced by the mother. That is firstly produced by the mother during the first attempt of breastfeeding. That is why breastfeeding is best for babies. Next is your passive artificial. Those are immune serum antibody from an animal that is injected to humans. So those are your vaccination. We have your BCG, Hep B, and all during our immunization period in our earlier years. And then we also have your measles. So the immune response have two components. We have antibody-mediated defense and then the cell-mediated defense. So your antibody, these two systems provide distinct but overlapping protection. The antibody-mediated defense, the antibody-mediated defense is also referred as to humoral immunity, since it resides ultimately by B lymphocytes as it's mediated by antibodies producing B cells called immunoglobulins. So those immune system, the one that I'm talking about a while ago, the IgA, it has your immunoglobulin A. It also contains antibody. You have lots of immunoglobulins in the body, and it has also specific functions, such as, for example, the IgA nga. And we have also the IgM, the IgG, and the IgE. So we're going to discuss that more fully on our next modules. Then the cell-mediated defense or cell immunity occurs of the T cells or the thymic lymphoid cells are present in your thymus at birth. So at birth, you are protected also by your immune system, the thymic lymphoid cells, and of course your that is your T cells. Okay. Now we have to discuss the chain of your infection. So remember how actually you may interchange the pattern, pero dili pwede nga dili siya masunod, ha? Dili pwede nga dili masunod. So we have there figure 1-3, chain of infection, the entrance portal, the host, the causative agent, the reservoir, and then the exit portal, and then the mode of transmission. We also have another pattern, but they have to be in order. First is your pathogenic microorganism or the causative agent. So your pathogenic microorganisms are either bacteria, virus, fungi, protozoa, and you also have parasites or the carrier. So when you say bacteria, it is a one-celled microscopic plants that multiply very quickly. Example of disease caused by a bacteria, we have your tubercle bacilli. What else? We have salmonella typhosa and typhoid fever, tubercle bacilli and TB. Another, we have also your meningitis, pneumonia that is caused by a bacteria, And then we have virus, the smallest known disease-producing organisms. So this is smallest known disease-producing microorganism. One thing you have to remember with your bacteria, it multiplies very quickly, while your virus, it spreads very quickly. Just like what we are having the COVID-19. Usually the virus affects now respiratory region, in respiratory region, such as your COVID-19. And then it usually spread very quickly. Why? Because usually airborne, droplet nuclei, plus your direct contact, just like your COVID-19. And we also have the fungi. Before we're going to discuss the parasites in the carrier, the fungi, these are microorganisms affecting now your areas that has this tendency to moist, thus producing a foul-smelling odor. Example sa imo ang ilok, di ba? It could be a fungi causing now an odor. Why? Kay basa siya, di ba? Kay dili siya manimaho kung dili siya basa. One thing you have to remember, if it has an odor, it has growth of microorganism. Another itchiness in our body, or such as your ringworm and all, it is caused by fungi. Another, katuloy mong kamot, abi ka kwarta, panghugas og kamot kay fungi na. After washing your hands, dili na siya katol. And of course, if it is your genital area, atol siya, possibly taas imong sugar sa babae, possibly increase imong secretion because you're about to menstruate. So you are attacked by fungi, di ba? You are attacked by fungi. That's why you could say na I was my husband, but yet it is fungi. You just wash your genital area with water. For example, nga nung attacking siya fungi, remember it is normal for a microorganism in your genital area, di ba? So if you have normal flora microorganism there, it should not be removed, di ba? But one thing you have to remember, if you always wash the genital area with soap, and soap is highly basic, yet your genital area is acidic, of course, it will ruin the acidity of the area. Thus, if it will become more basic, then of course, it will lead to itchiness. So, gi-atake ka fungi. So, much better you're going to wash your genital area with a salt, asin, o tubig, salt and water combined. I guess we have 2 tablespoons of salt to 1 liter of water, and it's much comforting if you're going to place the water inside the refrigerator and use it for washing or dodging, especially if you are about to menstruate, or while menstruating, or after menstruating. Another is we have protozoa, the food that you're going to take during food poisoning. Those are the microorganisms present in food that are not properly washed, not properly cooked. Those are the protozoa. So, what are the different mga street foods and all? So, refrain from eating soap. Especially katong are used, just like, for example, if you have cancer, you are not allowed to eat kinilaw. Why? There are lots of microorganisms in your kinilaw that are intolerable by your patient with cancer, or much preferable by the cancer cells that you have. So, refrain from eating those. And even, diba, dapat you eat raw fruits? No. If you have cancer, you should eat the fruit. All the foods that you have to eat should be cooked so that it is sure that the microorganism is zero on that particular food, so as not to trigger your multiplication of your cancer cells. Okay, next is your parasites. So, example kita, mga nanay, mga anak, kamo, dili ako, because I'm already a mother. So, parasites are microbes that lives in or another and obtain its nourishment from it. Example, ang mga anak, kasi pangay kwarta, they are considered parasites. What are they parasites? We have kuto, lusa, and we also have mosquitoes. They are considered parasites because they cannot live without a host, diba? And your kuto cannot live without host. So that is is considered parasites. And then the carrier, the person or animal who spreads the disease to other but does not become ill. So example, you may carry the microorganism yet you did not manifest the signs and symptoms. So for example, in case of your gonorrhea, diba? The women already have the sexually transmitted disease, or let's say AIDS, diba? Or what do you mean by AIDS? Acquired immune deficiency syndrome, or your HIV. The women already have the HIV, possibly, but they did not. The male partner already have HIV, but he does not manifest the signs and symptoms. Only the wife. And then, of course, where did the male get the HIV, or where did the male get the sexually transmitted disease? From a certain prostitute, beautiful prostitute, and then she used the prostitute, and after which he used also her wife, then now carrying the microorganism from the prostitute to the wife. Thus, the wife now, the male now, the carrier. So carrier siya. How about if he uses another girl? So he could spread the microorganism along, diba? We were going to spread the microorganism without those women knowing. So that is why it is considered as a carrier. So I have here the table, and I guess you have it in your handouts. Human sources and methods of transmission. We have there your body areas, respiratory tract, transport vehicle, your droplets, expelled while sneezing and coughing. Respiratory tract from your nose to your lungs, gastrointestinal tract, it does it from your mouth to your anus. You have your emesis. What do you mean by emesis? Emesis means imong giluwa. We have also the feces, of course. It is hereditary, so you have to protect yourself. And then the drainage such as for example, if the patient has secretions, such as your operations, nag-operation. So those are mga liquids or fluids coming out from part of the body, such as your gallbladder, are considered infectious. So they are drainage, so they are considered infectious. Plus also your saliva, gastrointestinal dapon siya. Reproductive tract or reproductive, you have your genitals, you have your urine and your semen. Okay, it is highly infectious. When you wear your protective equipment, your gloves. And urinary tract, we have your urine, and your blood, we have your blood samples, needles used for venipuncture, diba, injection. And tissues, we have drainage from a cut or wound, diba? You should refrain from holding those because you could be contacted with those microorganisms. Now, next to your microorganism, we have the reservoir, place wherein a pathogen is stored, lives, and grow. Okay, examples are soil tissues, linens, client supplies, commodes, thermometers, carrier, also is called as a reservoir. So what I've said, she does not manifest the signs and symptoms, but she have the disease or the microorganism. So the soft tissues and linens, soft tissue should be placed in a properly placed in the side of the trash can. And you're going to remove the trash can or the trash can. Make sure that it is the tissue is contained inside the trash can, inside the plastic. And then when you're going to throw the trash can, make sure you're going to seal now your plastic to contain the tissue. And when you're going to dispose it, you have to place it inside another plastic that is called now your double bagging. And then make sure that somebody will going to close the plastic for you outside the room of the patient. That is also why sa lines sa outer space. In another country, they already have their personal equipment such as your thermometers and other supplies. They did not share those things, and even the patient pays it, or the patient will going to pay for it once hospitalized. So it is also practiced here by, we have the kit, diba? Medina College, Medina College, then we also have the Misamis University hospitals. If they have a kit, I think the kit worth 750. It has some spoons and tissues and thermometers. Okay, then table 1, that's 2, we have your human resource and portal of exits. So reservoir, portal of exit here, respiratory tract, the portal of exit. Remember, portal of exit is similar to your portal of entry. Kung unsa yung entry, mapod yung exit. So your respiratory tract, the portal of exit, we have there your nose, mouth through sneezing, coughing, breathing, or talking. While your gastrointestinal tract, you have the mouth there through saliva. Vomitus is kanang suka or suka, sinuka. And then we have anus or salubot. Then we also have ostomies. Ostomies meaning, for example, walay lubot ang patient, then eyebrows obstruction siyang large intestine, bangagan ng yang large intestine, yung piyan bangagan, dito straight siyang large intestine, nandito siya malibang. Particularly, asa siya dapat malibang sa right side, ang bangag, diri right side. And then we have also your feces, drainage tube. Example, naso feces is tae, drainage tube. Example, naso gastric tubes or NGT. Reproductive tract, we have your vagina, vaginal discharges, then may be further transported by urine, urinary meatus, then seminal fluid, and then urine. While your blood, we have your open wound, then, of course, needle, puncture site, any disruption of the intactness of the skin, mucous membrane surfaces. Those are the human reservoir, or the place where the microorganism lives, and their portal of exits are on the right. So we have here the portal of exit now. Again, the portal of exit could be also your portal of entry. So body fluids, so it is mentioned there that your blood, semen discharges of male, and then urine, saliva, okay, and then your sputum, it comes from the lungs, diba, hukal, and vomitus, it comes from your gastrointestinal tract or your suka, and bodily secretions such as your sweat. They are highly infectious. Letter B, mucous membrane. Sa topa, we have mucous membrane even touching the lips of the person, the eyes, and all. It is considered mucous membrane. And then the oral cavity also, that's why you have to wear gloves. Letter C, especially when you're going to offer back the dentures or remove the dentures of the patient in elderly care. Letter C is tissues and organs of the body. Okay. Mode of transmission. We have a contact mode of transmission. We have the mode at which the microorganisms is being transported or contacted. It's contact transmission. We have three. We have direct contact, indirect contact, and droplet contact. So direct contact with person who is infected with the disease. Example of that, we have your gonorrhea and syphilis. And of course, we have the COVID-19. Because it is included now, your COVID-19 is direct contact. That is why you have to maintain 1 meter at least social distancing. And then number 2, we have indirect contact. Contact with items used by infected persons such as razor, towels, washcloth, glass, toothbrush, comb, and all. Example, comb. Diba? Example, gamit ka og comb of the person, you could acquire the disease, the kuto, the parasite present in the head or the hair of the person. And then we have your toothbrush. You're going to use one toothbrush. You could acquire mononucleosis or kissing disease from that particular person in direct contact. So you contact the microorganism via the object that she used. Next is droplet contact, secretions or respiratory infection. We have all the diseases when it comes to your respiratory system have droplet contact and sometimes direct contact, such as your COVID-19. Example of those: pneumonia, bronchitis, and all. Letter B, we have vehicle transmission. This is accomplished through a transporting agent of medium such as food, water, and your blood. Example of that, we have your diarrhea. Vehicle as examples, diarrhea or your food poisoning, diba? If you eat to areas such as your McDo or your mga barbecue, you could have problems such as H. pylori, diba? You may have H. pylori or gastritis. That is your vehicle transmission. The microorganism needs a medium, such as your food and water. Now, it would breed your blood. Letter C is airborne. Occurs by dissemination of droplet, nuclear, or dust particle, microbes, and remains in the air. Example, we have tuberculosis. Okay. Letter D is your vector. Vector animal to transfer the microorganism from a reservoir to a host. Example of which we have your mosquito bite or your dengue, fever, malaria, rabies, and all. Next day, portal of entry. Again, this depends to your intactness of the skin, or your portal of entry could also be the portal of exit. And then susceptible host. Susceptible because you have lower immune system, and the person who is at risk of developing the infection. Why? Because he has lower immune system. From the word susceptible, di ba? Baba na siya immune system, or elderly siya, or bata pa siya. Okay. Factors affecting risk of infection, we have age. So we have there your age, kaya underdevelop ang bata, hindi lang immune system. Onti ko lang po, based on the wear theory, they have been using up their immune system, diba? Number 2, great stress. Of course, if you're under stress, you cannot think properly, so you have this risk of infection. Imbis kayo iwas ka sa COVID, matulong ka sa person with COVID, diba? Without properly protective equipment. Number 3, we have chronic presence of illness, diba? Or acute illness. So, we have discussed that one already. Inadequate nutrition, kulang sa pagkain, walang protein, walang vitamin C, making one at risk of infection. And we have also poor living conditions, so your place in the squatters area, wherein microorganism to spread, has this tendency to spread very quickly. And we have also your poor hygiene, you did not wash your hand in eating, so you might ingest now the microorganism. Plus, you're taking lots of medication. Remember, in this saying that goes, in every pill there's a kill. Once you take especially steroids, medicine, it will going to lower down your immune system. Once your immune system will be lowered down, you could easily get the microorganism that causes the disease. Okay. Next is we have a chart here. Ang importante dira is you may interchange, but as long as ang pattern is the same, parehas lang ha. As long as the pattern is the same, no problem. So, we have infecting mild pathogen, we have your bacteria, virus, fungi, protozoa. And then, ang asa sila gapuyo with your reservoir, that is your contaminated material or your carrier. And then the exit, asa sila magawas. Ang mga microorganism, magitawag nato nga bacteria, virus, fungi, and protozoa. Portal of exit there is your body drainage, fluids, tissues, body waste, sputum, and then vomitus. Dayon, they were going to, asa sila mosulod. Method o kung saan nila pagsulod. We have airborne and physical contact, either direct or indirect. Direct or indirect. And then they could go inside or enter inside if they have broken skin and be able to enter into the host because the host has weakened or sick or no resistance at all, and thus having now your microorganism, the bacteria, virus, fungi, and protozoa. So pattern po siya. Pattern po siya. That is the cycle of infection. As what I've said, kahit saan or anong number 1, basta as long as the pattern is what they call this one, observe, no problem. Signs and symptoms of infection, we have redness. So we have the same with your inflammatory redness. So that is your swelling, pain, warm, fever, chills, headache, nausea, kasukaon, vomiting, nagsuka na jud, diarrhea, gikalibanga, and then coughing, giubo, and skin rashes or nagpula-pulang skin in cases of your allergies, or let's say example your measles also. And then fatigue. Example, fatigue, kapoy, gilaro yan. And number 10, you have pus or false meningitis of wound. So it could, those are the signs and symptoms of infection. So 4 stages of infection. We have infectious process. We have incubation period. Incubation period is the time between the entry of the microorganism into the body and the onset of the symptoms. During this time, the organisms adapt to the person and multiply sufficiently to produce an infection. Okay, produce an infection. So, example, in cases of your what we call this one, let's say, what they call this one, and in cases of your chickenpox, diba? Let's say chickenpox lang, or COVID na. So let's say COVID, diba? There are tawag sa COVID-19, we have there your carrier. They does not manifest the signs and symptoms. The microorganisms are incubating inside their system. Yung nandun sa loob sa body nila yung microorganism, pero walang signs and symptoms, di ba? Pwede, kahit pag-entry na ng microorganism sa kanilang katawan, ay nag-incubate na siya doon or nag-multiply na. And yet, the person is exposed to the public. Walang restriction kasi nga he doesn't know that he have the microorganism, and yet the microorganism is 14 days, and that is in 14 days incubating. That is why also that is why you're going to stay at home, or let's say you will be placed in a facility for 14 days. Kaya nga no, to make sure that while the microorganism is incubating, wala kang contact person. So you have this no chance at all to spread the microorganism while the microorganism is in you nga wala pa siya namatay. Manang dapat you have to get out from a facility or a quarantine facility after 14 days. And to make sure dapat after 21 days na jud siya, ha? Because usually the microorganism, especially it is a virus sa COVID-19, it will going to be present for about 14 to 21 days. So you are that infectious that time. So sa siya, it is the time between the entry of the microorganism into the body and the onset of the symptom. O, di ba? Tsaka mo na lang alam na may COVID ka kasi may inuubo ka na. But yet, you have infected several person already. Next is prodromal period. It is the time from the onset of the non-specific symptom such as fatigue, malaise kapoy, fatigue is kapoy also, elevated temperature plus irritability. That is your prodromal stage. While your period of illness is the specific symptoms develop and become evident. So, giubo-ubo na dyan kagtuda, dili lang dili lang elevated body temperature, fatigue, kundi giubo na dyan kaas into the maximum level na siya. So, meaning, the symptom of most infectious processes are manifested both in the affected body organ or area wherein the local inflammatory response of localized symptoms. Though in this particular period of illness, the host is highly communicable. But in the case of COVID, pag nandun pa, pagpasok ko lang ng microorganism sa'yo, communicable na siya. Manang dapat i-quarantine ka for 14 to 21 days. And then next is your convalescence at the convalescent stage. Disease may still be communicable, yet symptoms are absent already. That's your convalescent stage. That is also in the case of chickenpox. Wala nang symptoms, wala na siyang rashes, nag-dry out na yung rashes, so nag-heal na yung mga rashes ng individual, and yet the individual is highly communicable still. That during the convalescent stage. Okay, we have also the word nosocomial infection. Nosocomial infections are infections that were not present or were incubating at the time of admission to a hospital or other medical facility. They include infectious clients acquired during their stay in the facility, that is acquired or manifest after discharge. Nosocomial infection is definitely hospital-acquired infection, or the infection that you get from the hospital. So, for example, you have a friend inside the hospital na na-hospitalized, let's put. So, na-hospitalized siya. So, since the patient is hospitalized, you have this close man mo. So, you're going to visit the person. So, during the visit, you are well and good. You talk to the person and all, and you're happy, true, and you said that, okay, you get well soon, something like that, and then, okay, bye na. So, okay, after na, okay, sige, bye, get well soon, and then you reach your house. After reaching your house, you felt as in, your body is so heavy. Why? Because the different microorganisms are namambitay sila sa imo sanina. Dapat you have to take a bath, especially if you are from a hospital. Why? Because of what we call your nosocomial infection. If you're coming from the hospital, you have to prevent yourself from going to the mall, going to the restaurant and all, because if that's the case, you're just spreading the microorganism. Ang dapat mo gawin, umuwi ka muna, maligo ka, and then you change your dress so that you're going to prevent the spread of the microorganism. So your question now, ma'am, bakit hindi ma-infect yung mga hospital personnel? Okay, so hindi sila ma-infect kasi friend na sila ng mga microorganism. They develop this what we call immunologic response against a certain microorganism. O pag bumundan yung microorganism nito, masabihin niya, huy, hawa, di ba? So, parihara sila. Meaning, pareho na sila o kung sa resident na sila parehos. So, dili na sila. Walay talo ba? Pero ikaw kay intruder maka sa hospital, so you become attracted to them, the microorganism. So how are you going to break the cycle of infection? One is using antiseptic solutions. These are agents that inhibits the growth of the microorganism. So, and then we also have disinfectant solutions in agents that destroys pathogens and its spores. So, antiseptic solutions are such alcohol, di ba? Alcohol, antiseptic solutions man siya. It inhibits the growth of microorganism, but it doesn't mean that it will going to kill one. While your disinfectant agents that destroys pathogen and its spores, example of these are Lysol, your Zonrox, Clorox, and all. So, those Domex, disinfectants siya. So, may mas grabe, disinfectants or antiseptic? Of course, your disinfectants, because it will going to kill the microorganism. And your means of sterilization and disinfection, we have physical means and your chemical means. So, we have here the physical means and the chemical means. So, remember physical, so we have your physical. For example, exposure to radiation, diba? That's your physical means. And your chemical, adding Clorox or adding Lysol solution as a soaking solution here in glass. So those are your chemical means. Okay. Physical means, again, we have plenty. We have the steam under pressure, steam in water vapor, magputo bitaw, magputo, butang ka dito kanang container, sa puto ba? Rice cake. So steam is water vapor and in saturated state. It can exist at a definite pressure corresponding to a given temperature. Moist heat, so remember, moist heat in the form of saturated steam under pressure is the most dependable and practical means for the destruction of all forms of microbial life. Its primary disadvantage is that items that are sensitive to high temperatures, such as most plastic, lens, instrument, drugs, and thermometers, are damaged by steam under pressure. An example of these are autoclaving and using a home rice cooker. So, example, your steam under pressure, we're going to work this way. Kaman naman ang puto, or kanang steam o kanang example puto. Diba? Na boiling water sa ilalom. Dayon na ay layer dila nga bangag-bangag, and then you're going to place the cups of puto, and then while the water is boiling there, then you cover that, of course. While the water is boiling, the puto will be cooked, di ba? Same in napod ang steam under pressure. I-cover siya, naiga water nga, gaboy nga water sobos, and then naay mga gipang-pack nga mga hospital instruments sa taas. So, nag-steam siya, chuk, chuk, chuk. Then, after that, well, during the steaming time, it will going to cause disinfection or sterilization. Another thing also, kanang puto. Aside from that, we also have kanang autoclaving. So, ibutang siya dito sa katong autoclave. Kasulod, then, naay nag-boil ng water, then after that, naibabaw na itong mga equipment, then well, nag-boil, matong may sterilize. Another thing is, we have steam under pressure also. Lagi mo na to siya. Okay, next is boiling water. So, boiling water is also used, diba? So, anyways, some, what we call this one, your sterilizer, bottle sterilizer are also steam under pressure, ang uban. But they're limited time because remember, steam under pressure, we're going to destroy the plastics. So, boiling water. Two advantages of using boiling water are they are inexpensive, and of course, they are simple. A disadvantage is that if spores are present, boiling water is not a practical method of sterilization. Nga naman, because the boiling does not kill the spores of the microorganism. So, pag boiling water ka, nga naman hindi siya makill, kaya since the temperature of the water cannot rise above 100 degrees Celsius or equivalent to 200 degrees Fahrenheit. Hence, the time required to kill spores is longer and unspecific. When using boiling water, also some viruses are resistant to boiling. Yes, of course. And boiling water is commonly used in homes, although authorities differ. It is believed boiling an item for a minimum of 15 minutes can achieve disinfection. Anyway, usually, boiling is the most practical means. Just the example, sterilizing bottles, diba? Pero, as what I've said, it doesn't kill its spores. Mana, time is a key factor. Dapat, you have to sterilize the bottles much longer. Excuse. Because time is a key factor when sterilizing or disinfecting articles. Failing to observe recommended time periods is gross negligence, except in the most dire emergencies when even then very careful judgment should be prevailed. Okay. Next is free-flowing steam. The primary advantage of using free-flowing steam is that it is inexpensive. It has the same disadvantage as boiling water. Also, this method has limited practical value because it is difficult to load a free-flowing steam chamber in a way in which all equipment is exposed fully to the steam. Okay. So, usually pag free-flowing steam, gyapan, pareha siya sa boiling, ha? Pwede gyapan ng bottles to be sterilized. Okay. Then, limited lang ang space for free-flowing steam. Kasi kaldero lang yung gamit mo, di ba? And then, dry heat. So, those are the moist heat, ha? Kung sa itong mga moist heat, we have the boiling, steam under pressure, and then the free-flowing steam. While your dry heat, this has It has the disadvantage of being harmless to objects that are damaged by moisture, such as cutting edges of sharp instruments, the ground surface of glass, and powders. Its disadvantage is that the penetration ability of dry heat is not believed sufficient to destroy all microorganisms. Dry heat may be used in some home situations to achieve disinfection, such as an ordinary baking oven can be used for this purpose. Pareha isa, kayang gihapon ng heat, ha? And dry heat, pwede rin naman siya, radiation, exposed naman siya sa heat of the sun. And pwede rin gihapon kaniyang giingon niya nga baking an oven. Anyway, pag wet heat or moist heat, you need a stove. Stove ang gamiton. While your dry heat, you need an oven. Okay, remember that. And then, pag stove ang gamitin, you need a pot. Diba? Pag dry heat, of course, you need a pan. Okay. Then radiation is also a dry heat. Example, non-ionizing and ionizing radiation are used for sterilization and disinfection. The most common type of non-ionizing radiation is ultraviolet rays. They have the disadvantage of having limited practical use in health agencies because their minimal penetration ability and the need for careful controls while using them in the home. Natural ultraviolet rays in the form of sunlight can be used to achieve some degree of disinfection. Bali-balihon siya dapat. Balihon ang unlan, di ba? To disinfect. Okay. So, kung baga kayo mong unlan, so, maluspad na lang yung panapton, di pa siya makadisinfect. Now, this is your chemical means of sterilization and disinfection. Some authorities state that no chemical solutions can be considered safe for sterilization. Hence, the use of chemical solutions ordinarily is limited to items that are heat sensitive or to situations in which a more reliable method of sterilization isn't available. However, chemical solutions are commonly used as disinfectants. So, disinfectants destroys organisms by disturbing the structure of the metabolic processes through coagulation and alteration of the cell membrane and the cell protein. Examples of this are vinegar solutions and bleach solutions. Vinegar solutions ratio is 1:3, 1 cup of water is to 3 cups of vinegar, and your bleach solution is 1:10. 1 cup of bleach is to 10 cups of water. 1 cup of vinegar there is to 3 cups of water. Excuse me. And your 1 cup of bleach is to 10 cups of water. Baliktad yun sa akin. Standard precaution for infection. Remember those, the vinegar and your bleach solution. The vinegar and the bleach solution can be used now as a household solution. You have a procedure na in your handouts. So you have to understand the wet heat and the moist heat. What are those equipment that can help you disinfect using the wet heat, and then what are the materials to be used in disinfecting, and then you have also the chemical, and then we have the physical means. And of course, you need also the solutions, the bleach solutions, and then the vinegar solutions. And don't forget the ratio. And you could use this too as a household solution. And how we're going to do it, that would be the things that we're going to have an oral exam on Thursday. Standard precautions for infection control. So how? Wash hands using antimicrobial agents. Okay, so going to do hand washing. Wear gloves. Of course, we're wearing gloves, especially handling mga soiled equipments and materials, and then we have secretions from our patients. And wear masks, especially respiratory regions such as your COVID-19. And the next is your wear gown. Yes, especially if it is COVID. And then we have also, especially during OR operations. And if another thing, if you are on duty in a communicable disease ward. And patient care equipment, remember that all patients have their different personal equipment. Pero in the Philippines, we don't have it because your BP apparatus is very expensive. Pero dapat naagin na siya dapat. And the next is your patient placement. So the door should be closed. The door should be closed nga naman to prevent the microorganisms from doing chit-chat with other microorganisms. So to contain the microorganism, to contain the patient, and of course contain the microorganism. And then we have also occupational hazards. We have health hazards and bloodborne pathogens. Those mga needles should be placed in a puncture-resistant container to prevent it from infecting other individuals. And environmental control, so you're going to place the patient you place the patient directly to the assigned room. Another thing, do not let the patient try to have a tour inside the hospital. Once you have the tour, so since he is infectious, especially if underdiagnosed, you just keep the patient inside the room. He will going to spread the microorganism kaya underdiagnosed pa man siya. Mao pa na siya reason that the communicable disease ward are placed at the end part of the hospital or the top part of the hospital. Dili sila pwede nga Dili sa pwede nga magnaog-naog, chuk-chuk-chuk, or balik-balik, chuk-chuk-chuk. We are highly infectious. Okay. So mapo na siya reason. And the next is your basic rules for universal precautions. One is wear gloves when in contact with blood or semen, vaginal secretions, or other body fluids. And then we have also wear gloves when the skin is broken. Wash hands before and after gloving, so you have to do that. Wash hands immediately. I won't discuss this further because it's self-explanatory. Wash hands immediately after being contaminated with blood or other body fluids. And then clean up blood or body fluid spills immediately with bleach and water solutions. And then put your vinegar solution. Do not handle used sharps such as needles. It should be based in a resistant. Ask client to place used shrubs in puncture-resistant container, biohazard needle box container. We have that in the hospital. Wear personal protective equipment as required by the agency. Avoid splashing when disposing of content of bedpan, urinals, or your commodes. If splashing occurs, clean area immediately. So those are self-explanatory. Wear gloves when disposing soiled sanitary napkins or tampons by your patient. Of your patient. Do not eat, drink, apply cosmetics, or handle contact lenses in areas where exposure to blood or other potential infectious materials. Those are the basic rules in universal precaution. Now, we will have also the 10 common sense rules to prevent the transmission of the disease. So, self-explanatory recap na siya. You have to wash your hands after using the comfort room. Wash your hands before and after handling or preparing food, including before and after eating. So you have to do at least few of this. Cover your nose and mouth when coughing, sneezing, and blowing. That is also etiquette, diba? Wash your hands after coughing, sneezing, or blowing the nose. Use your own personal items. Do not borrow from others. Use own drinking and eating utensils. Yes, that is very much important. Practice good personal hygiene and maintain good grooming habits. Wash raw fruits and vegetables before serving and eating. And prepare and store food properly. Or the food that should be stored inside the refrigerator should be stored in the refrigerator. Why? Because it doesn't mean that the microorganism is not growing there. But it will just delay the growth of microorganism because of its controlled temperature. Use good housekeeping. Okay. Dapat linis-linis din pag may time. So substances includes in universal precautions. We have your blood, bowel unit. You have to use the PPEs here, your personal protective equipment, such as your gloves, mask, and your mask. Gloves, mask, goggles, and your hairnet even, plus your boots, pwede pa. And blood, semen, vaginal secretions, cerebrospinal fluids, or the fluid from your spine, diba? So, your fluids, that is the fluid from your joints. Pleural fluids is the fluid in your pleural, or your lungs. And then peritoneal fluid, same peritoneal, sa bones. And pericardial, that is your pericardium, so heart, fluids in heart. Amniotic fluid, fluid that covers the baby, diba? Or that goes that makes the baby float inside the womb, the amniotic fluid. It prevents the baby from infection, of course. So wear your gloves. So now is your medical sepsis. It's the use of techniques and practices to prevent the spread of pathogenic organisms from one person to a plate or to another. So, self-explanatory naman siya. Common practices of medical sepsis techniques. These are techniques to reduce the number of transfer of pathogenic microorganisms, are constantly being observed in daily living. Typical examples are as follows: in public hospitals, in public facilities, hospitals na. The use of paper towels in the restroom, yes. The use of individually wrapped drinking straws, yes. Another thing is we have the examination of food handlers for evidence of disease. So, for example, yung urine and stool exam sa mga food handlers, that is very much a must. In the home, the washing of hands before preparing food and before eating. The preparation of certain foods at temperatures sufficiently high to ensure they are safe to eat. The most common example being in preparation of this, we have fresh pork, diba? Manang if you're going to have the pork, you have to, dili pwedeng nga ipalit mo na 3 kilo every time you're going to cook a portion of it. You're going to get the entire 3 kilo from the refrigerator or the freezer, ha? You will, before you're going, after you purchase the pork, you have to separate it according to the number of person that you're going to feed para for cooking. Di pwede gawas mo tanan. Okay? Once it is out from its controlled temperature inside the freezer, it will start the microorganism to grow. The washing of fruits and vegetables before serving them is in a raw state. Dapat i-wash siya. So hand washing is often stated that is the single most effective way to help prevent the spread of, diba, dapat sa COVID-19, dapat naka-wash hands. The spread of organism is to wash the hands thoroughly and frequently. The role of the hands as primary vehicle for transmitting the microorganism while administering healthcare is no longer debatable. But unfortunately, hand washing practices often appear more ritualistic than realistic. Dapat ritualistic yung balik-balik kag-wash of hands. Okay, that is to ensure that you are free from a certain microorganism. So we're going to discuss, they're going to demonstrate now the different hand washing procedure, either medical hand washing and then your surgical hand washing. Remember, is your hand washing is the key component of medical asepsis. Remember that key component of the medical asepsis. So, medical asepsis is not there without hand washing. Okay, and then we will proceed to surgical asepsis. An object is sterile only when it is free of all microorganisms. It is well known that surgical asepsis is practiced in operating rooms, labor and delivery rooms. Labor and delivery rooms, and of course, special diagnostic areas. What is your surgical asepsis again? It is a sterile technique. So, example of that, you have donning and removing sterile gloves. I have here the picture. Picking up, I'm going to demonstrate this one anyway. Picking up the first sterile gloves, you read this, putting it on, drawing a binasha. Okay, putting on the first sterile gloves, picking up the second sterile gloves, and putting on the second sterile gloves. Anyway, I'm going to send you a demo on this. The old demo na lang because I failed to do the demo because of the electron, my goodness. And then putting on the second sterile gloves. Okay, you have to take note on how to put it on and how to remove. Those are the things. And of course, holding on the sole disposable glove inside outermost. So you have to dispose it as one piece. Discard the sole disposable gloves into the trash box and consider it infectious. Next is your isolation precaution. Practices indicated when a client has an infection that can be transmitted. So how would you going to use that? Apply gown. Wash your hands, insert the arms into the sleeve of the gown with opening with the back in the back. Tie the neck string, close the back opening by overlapping one side of the gown over the other. Tie at waist string. I'm going to send you a video of this. Give client care. Removing contaminated gown. So untie the waist string, untie the neck string, pull down down on the shoulder with neckties. Leaning forward, turn the gown inside and out, removing it. Keeping one hand inside the sleeve of the gown, use it to pull the other sleeve. Do the same, the other, and then roll up the gown into a ball. Keep containing the area, discard it into proper container, then wash your hands. And then, of course, the washing of your, applying the mask and removing contaminated mask. So, you read na lang the procedure anyway. Anyways, naasya dito sa inyo ang handouts. And I'm going to also demonstrate this. Precautions to limit the transfer of microorganisms by equipment. A second common vehicle for transmitting organism is equipment and supplies. The following are commonly recommended practices to help control the transmission of organism by equipment and supplies. Such equipment as a sphygmomanometer, a stethoscope, and other items used for this physical examination should be left in the patient's room until that illness has subsided and is no longer infectious. Sorry. So, as what I've said, dapat ang mga personal protective equipment should be placed, or no, the personal items of the patient should be placed inside the room. Thermometers and then your BP apparatus. Disposable thermometers are preferred. The reusable thermometers should be left in the bedside for the duration of the patient's illness. So, linens should be removed from the patient's room and by using a double bagging technique. So, this is what I'm saying, the double bagging. So, remember double inside the room, you have the bag here, pwede siya linen ha, pwede po siya trash. And then, since it is contaminated, you're wearing gloves, you're wearing mask, so naka-PPE ka. Pwede po ka mag-hairnet if you want, then you have to goggles and all. Bonnet, anyways. And then, excuse. So you place now the swab equipment on the bag of the patient, inside the room of the patient. For example, kung trash ka ni siya, na siya yung container, di ba? Then ay plastic. So i-place mo dito sa imong swab linens or swab trash. Then manang place ito, i-seal po na nimo siya. Seal. Then when you go to the room, you're going to place that bag here, first bag on the left side, inside. To the bag outside, kani siyang naanay container. So, i-place mo siya dito, pero dili ikaw mag-seal. Somebody will going to seal it for you. Okay? Somebody will going to seal it for you because your hands is very much infectious. You're holding the dirty bag. While this one is the clean bag. Kaya nga, siya man. And then, you have the transporting medium na siya wheels, kaya para dali ra. And then, ikaw ang transport? No. Other person will going to do that. The transporting. That ends up our basic infection control 1. So I'm going to send you the video of the what do you call this one? Of the procedures necessary for return demonstration. It should be made by yours truly also. I'm going to send it to you. Maybe this I'm going to send an old video. Okay. The old video na lang akong isend. I'm going to send it after sending this one. And you have to practice tomorrow. Not to practice. You have to practice at home. Para tomorrow you're going to do it na. Okay. So, old video. I'm going to send the video. And then, of course, thank you for listening. Thank you for choosing International Helpline Caregiver Training Center, Ozamiz City. And this is the video today, May 9, 2022. And, of course, do not forget to like the video. Bakit mag-like sub? Okay, nga naman. Para madagan ng video. So, I would be happy if the video will be spread, diba? And of course, if you're going to like, and then, of course, you have to subscribe. Thank you very much, ha? Kung ipunang yung subscriber, dapat na-subscriber, Jod, ha? Thank you, mga ging.